Obesity and overweight are becoming a very serious concern in many parts of the world, including Europe, where it is becoming a public health problem. There is enough literature to show that overweight and obesity is one of the major causes of comorbidities. Most common include type 2 diabetes, different types of cancer, and cardiovascular disease. According to the World Health Organization, in 2015, there was about 2.3 billion overweight people in the world, aged 15 years and above, and over 700 million obese patients. Overweight and obesity, apart from being a health risk, they come with a price to the health sector. The National Health Services in the United Kingdom estimates that direct costs on health services ranged between 479.3 million in the year 1998 to 4.2 billion in 2007. When we talk about direct costs, we are referring to admissions to hospital because of obesity and overweight. Indirect costs caused by obesity and overweight over the same period of time in the UK range between £2.6 billion and £15.8 billion. Examples of indirect costs are disabilities, outpatients care, and free medicines given to these patients. There is extensive literature on the cost of obesity on hospitals and the healthcare setting. But is this the only concern that we have about obesity and overweight? Are we looking at obesity and overweight with much concern as prevention of other diseases, for example cancer? What factors enable a long-term healthy behavioral change for a healthy diet and an increase in physical activity? Are we ensuring that these patients have the necessary knowledge, skills and confidence to successfully manage the condition of obesity and overweight, especially following admission and discharge from hospitals? Obesity and overweight patients will be mostly admitted to hospital because of a secondary related problem, for example high blood pressure, and will be treated for that condition and discharged home once his or her blood pressure is stabilized. But what is being done to have a change in patients' lifestyle and manage better obesity or overweight once patients find themselves back in the usual residential setting? In the UK, structured programs are being used for long-term conditions following a newly diagnosed disease. These programs are a step forward in patient-centered care. The Institute of Medicine defines patient-centered care as providing care that is respectful of, responsive to individual patient preferences, needs and values, and ensuring that patient values guide all clinical decisions. Diabetes, for example, is one of the few long-term conditions where patients are offered structured programs. Some key criteria are the following: a structured written curriculum, trained educators familiar with the program and its delivery, and the process audit of the program outcomes, including biomedical, psychosocial, and patient's experience. With a centered care approach, following key criteria from other structured programs that are being used now in the UK, I am proposing to do a research so that a structured program can be offered to obese and overweight patients following discharge from hospital, as to minimize the complications of the disease, which is spreading all over the world. The objectives of this research are to gather information from obese and overweight adult patients that have been admitted to hospital following a secondary problem related to this disease. I want to know more about their quality of life, eating habits, psychological well-being, the daily needs, their readiness to make a change, their social and family history, and what they know about the risks of being obese or overweight. Most important, what will trigger them to change their lifestyle, and what barriers there are that is impeding them to do so. The information gathered will determine the attitude of these patients towards obesity and overweight, and the will to make a change in their lifestyle. The aim of the research following gathering of the data is to build a structured, comprehensive program for these patients and to be offered to patients following discharge from hospital. During the planning of this structured program, the 8 principles of patient-centered care conducted by the Picker Institute and Harvard Medical School will be followed. Looking at the research proposed, I am going to gather data from adults aged between 35 and 60 who were admitted to hospital with secondary diseases related to obesity and overweight. I will adopt an exploratory orientation. Therefore, I will be using an interpretivist approach. As Newman et al. State, the goal of an interpretivist is to understand and interpret the meanings in the human behavior. For an interpretivist research, it is important to understand the motives, meanings, reasons, and other subjective experiences of individuals. In this case, we are talking about patients. This is the best approach to understand patients' concerns, beliefs, and needs. An interpretivist approach usually uses a qualitative approach, but when looking at the objectives of the study, a mono-qualitative approach will be inadequately insufficient to produce satisfactory results. Therefore, a mixed method, explanatory sequential design, will be used. Quantitative data will be analyzed, and with the obtained results, a qualitative phase will be built as to interpret the quantitative results using the qualitative data. As Raven et al. State, a mixed method has the potential to harness the strength and counterbalance the weaknesses of both approaches. An explanatory sequential design can be powerful when addressing a complex issue such as health services interventions. The research project will be conducted as follows. The existing literature will be reviewed to identify what we know about obesity and overweight, what patients know about the disease, and what help is available for these patients once they are discharged home following admission to hospital. A quantitative questionnaire will be put together to be sent to selected patients that will be taking part in this research. The data gathered will be used to identify the objectives mentioned earlier in this presentation. After analysis of the quantitative data, a set of open-ended questions will be gathered, which will be used in a number of focus groups to collect the necessary data. After analyzing all the results, a structured program will be built. Before starting gathering the data, certain ethical considerations have to be considered. Informed consent. This is one of the major ethical issues when conducting a research. Arminger says that informed consent means that a person knowingly, voluntarily, and intelligently, and in a clear and manifest way, gives consent. Research should be based on the participants' freedom of volunteered informed consent. There has to be an explanation what the research is all about and how it will be disseminated. The right to refuse should be made clear. Confidentiality is one of the standards that is applied to help protect the privacy of research participants. A stricter standard is the principle of anonymity, which essentially it means that the participants will remain anonymous throughout the study. This research will have to consider both of these ethical issues. Total anonymity can be used during the first phase of the research, when quantitative data is being collected through a questionnaire. Confidentiality will be used in the second phase of the research, when the focus groups will take place. In medical research, there are 4 ethical principles that have to be considered, which are autonomy, justice, beneficence, and non-maleficence. The last 2 ethical considerations, beneficence and non-maleficence, are the ones that mostly address the concerns of patients. The principles of beneficence is in place to ensure that the research study will generally benefit people. The principle of non-maleficence goes hand in hand with beneficence. This principle is in place to make sure that researchers do not create studies that intentionally hurt or harm people. Reflecting on this research, it will increase public knowledge about the causes, consequences, and treatment of the weight problem. It will improve access to weight management, information, and the actual structured program that we are going to build for these obese and overweight patients. It will improve education and training, but not only to patients, but even for health professionals in the care of overweight and obese patients.